Mrs. Smith, you're going home today. You're all packed up, ready to go, I see.
Yes.
Yes, probably anxious to get home again.
My word.
Right. Well, I've got your tablets here ready for you to take home. So as soon as I go through these, you can scoot off out the door. Okay? Right. Now, there's the amiodarone tablets. They're the new ones for your heart. You take one of those twice a day, okay? And there's the digoxin tablets. They're the blue ones that you were having before. You'll remember those. It's one a day. All right. Now, the fluid tablets, your Lasix, they're one a day as well. And there's the potassium tablets that you have to take with those. They're the orange ones. You had those at home as well too. One twice a day for those. And you have to swallow them whole, okay? That's very important. Now, the other ones you're taking are the isoptin tablets. They were the ones you had at home too, the green ones. Right, just one a day of those. Now, then again, the next one is the other new one, the warfarin, all right? You have to take those tablets every day too at night time. Now, the dose of those can change, but we'll talk about that in a minute. It's very important that you take all of these tablets the way that I've told you, okay?
Yes.
Well, that's my pager. I better go and answer that. I'll be back in a minute, all right? Mrs. Smith, I've been so busy today, I haven't even had time for my tea break. Now, where were we? Oh, yes, that's right. We were talking about your warfarin tablets, weren't we? Now, they're the ones that thin your blood and stop you from getting blood clots that block up your arteries, okay? Now, it's important that you take those at the same time every day, and you have to have blood tests to determine the dose of those. The doctor will tell you from time to time when to change the dose. I've put 3 different strengths of tablets in there, so you can work out, how many of each of those tablets you have to take to get the right dose, okay? Now, here's a book, all right, with some information on the warfarin. You can have a read of that, and it tells you in the front, it's got all the colours of the different strengths of the tablets, so you'll be able to figure out which is which. It tells you a bit about the tablets in there too and the things you should look out for, so have a read of that. And just remember to turn up for your blood test and everything should be fine. So I'll leave those tablets with you, and all the best. Okay? Bye-bye.
Thank you.
Oh, hello, Mum.
How are you? I believe you're going home tomorrow.
Yes, I think that might be right.
Well, I've got some tablets for you.
Oh, yes.
And I thought we might go through them now, so that if you've got any other questions, we can have another talk about them before you go home.
I'm so glad that you've come again, because my memory's just so dreadful. I hardly remember anything you told me about all these tablets.
Well, Sophie, what I'm going to do is I'm going to make you one of these charts, so it'll have all the names of your tablets written down so you won't forget.
Oh, that's wonderful,
okay?
dear.
And it's also written on all your labels here. So let's just have a look what we've got. I'm going to go through them one by one. Now, there's quite a few.
Yes.
That's why I'm going to give you a list, because I don't want you to get confused.
All right.
Okay? Let's talk about the amiodarone first. These are the new ones. Do you know what they're for?
They were for the heart rate.
That's right. They're to help make your heart beat regularly. That's just my beeper. That's okay. So these amiodarone tablets, they're for your heart. Now, do you know how many they've been giving you in the hospital?
That's 2 tablets?
That's right. At the moment, it's 1 tablet in the morning and 1 tablet at night.
Oh, yes.
But what happens with these ones is the dose might change. So when you go back and see the doctor when you go home, he might tell you just to take 1 a day. But until you hear otherwise, it's 1 twice a day.
All right.
Okay? Now, there are some side effects about this one. Do you remember I had a bit of a talk to you about these ones? They can give you a bit of a metallic taste in your mouth.
Oh, yes.
And you also have to be careful. There's a little label on here that tells you to be careful when you go out in the sun, because you can be more prone to getting sunburn. So I want you to be very careful and make sure you wear a hat and some sunscreen when you go outside when you're taking these ones.
Right.
Okay? There are some other side effects, but your doctor will keep an eye on those, and it's nothing for you to get too worried about. But if you notice anything unusual, you should always tell your doctor.
Right.
Okay? So that's the amiodarone. These are the digoxin tablets. Do you remember those ones? You were taking those at home.
The little blue one.
That's right. And okay. Now, these are the ones that we've spoken about while you've been here as well, the warfarin tablets. Have you been doing your homework?
Yes.
Okay, you've studied up?
Yes.
Have you got any questions about them?
I'm just not sure how much I'm supposed to take.
Okay. Do you understand that you have to go for regular blood tests and that the results of those blood tests will let the doctor decide how much he's going to give you?
Yes.
Okay. Now, you can see here there's 3 different bottles and they're all warfarin tablets. The different colours mean that they're different strengths, that they've got different amount of warfarin in them. So the green ones, they're the 5 milligrams. The purple one are 2 milligram tablets. And these beige ones, they're 1 milligram. Okay? Now, do you know what dose you're going to be taking tonight? I haven't told you? Okay, so on your drug chart, it says tonight that they want you to have 7 milligrams. Now, if you had to tell me how you were going to take 7 milligrams, how would you do that?
Would I take 7 from each bottle?
Okay, that's not quite right. They want you to have 7 milligrams. These ones are 1 milligram, these ones are 2 milligrams, and these ones are 5 milligrams.
1 mg.
That's right, mg, you want to take a total of 7.
5 mg. So I would take 1 of these and 1 of these.
That's right, a 5 and a 2, so that makes a total of 7.
Good.
So each day, or each couple of days when the doctor tells you what dose to take, you can use these 3 tablets to get the right dose.
All right.
Does that make sense?
I hope so.
Okay, we're going to come back and remind you again in the morning because after you've had your blood test, the doctors will decide what dose they want you to have for tomorrow. Okay, now we've talked about everything in the book.
Yes, that's very helpful.
Okay, and you understand how important it is that you have your blood tests done regularly?
My word.
Good. Now, what else is there? There's your eye drops.
I've got those.
Tomoptol, you have to keep using those. They're just the same. And you can keep using your Newlax. And we had a bit of a talk about your sleeping tablets, and you'll try not to use them as much.
I'll try.
Try some of those other techniques. Okay. Now, like I said, I'll be back in the morning. I'll make sure I get the list filled out for you, and we'll let you know what dose of warfarin to take.
Thank you so much, Mum.
That's okay. And remember, Flossie, if you've got any questions, you just ask. Okay?
Thank you, dear.
Good. I'll see you again in the morning. Bye.
Bye.